First of all, I'd like to acknowledge the support of the interpreters we have today with us. So Tim on French, Miguel for Spanish, and Rashid in Arabic. So thank you, good morning, and good afternoon to everyone. Depending on where you're joining us from, thank you for being with us today. This webinar will be recorded so that we can share the recording with anyone who was unable to attend, and the recording is in process already. Please feel free to introduce yourself in the chat, who you are, your name, where you're listening in from, so that we know who we all are. On to some housekeeping items. So please keep your mics and cameras off to save on bandwidth. If you have any questions about the presentation or that you would like to bring to our presenters, please put them in the Q&A box. And this box is next to the globe icon in the bottom of your screen, at the bottom of your screen. We will ensure to take time throughout the webinar to answer your questions in the Q&A box. And if there are any outstanding ones, they will be answered after the webinar and shared with you all. For any other general questions or comments, please put them in the chat. And today, our webinar is on the topic of communicating infant and young child feeding during emergencies and the role of the media. So getting the right message across. Yeah. Next slide, please. This webinar is organized jointly by the Global Nutrition Cluster Technical Alliance and the Infant Feeding in Emergencies Core Group. In this slide, you can see the logos of all the member organizations of the webinar working group, as well as our donors, without whom we would not have been able to deliver this webinar. Next slide, please. Just to quickly give an overview of the Infant Feeding in Emergencies Core Group, or the IFE Core Group. The IFE Core Group is a global collaboration of agencies and individuals committed to the protection, promotion, and support of appropriate infant and young child feeding practices in emergencies. It was established in 1999 and was created to respond to concerns and gaps related to infant and young child feeding in emergencies. The IFE Core Group is dedicated to ensuring more effective infant and young child feeding in emergencies support in emergency contexts by strengthening learning, guidance and policies, planning, and capacity in infant and young child feeding in emergencies. Now, the QR code that you can see on this slide will take you to key global resources on infant and young child feeding in emergencies produced by the Core Group. Next slide, please. So the objectives for today's webinar include, first of all, sharing and disseminating existing infant and young child feeding in emergencies media resources that have been produced by the Infant Feeding in Emergencies Core Group. And then we will also want to showcase positive, harmful experiences of infant and young child feeding in emergencies communication during emergencies. We want to also identify how to prioritize infant and young child feeding in emergencies communications amongst the other priorities in the first few hours of an emergency. And finally, we would like to solicit inputs and suggestions from yourselves as participants on gaps and in guidance and tools that could be addressed by the Infant Feeding in Emergencies Core Group and the collective and the overall collective. Next slide, please. So today's agenda, so now that we've completed the introduction, we will be moving on to a quiz. We will have 3 presentations and then a Mentimeter session and Q&A session, and eventually close the webinar. I'd like to please note that the opinions expressed within the content of this webinar are solely the authors and experts, and they may not reflect the opinions and the beliefs of the Global Nutrition Cluster Technical Alliance and or those of the Infant Feeding in Emergencies Core Group. If we can move on to the next slide. So without further, so just before moving on to starting our webinar, I would like to present our key speakers and facilitators. So we have Alex Yeyamo, Senior Emergency Nutrition Advisor from FHI 360. Myself, IFE core group coordinator within the core group and emergency nutrition network. Dr. Colleen Gribble, a steering committee member of the IFE core group, also at Western Sydney University. We have Aisa Soumana, a nutrition specialist at UNICEF in Burkina Faso. We have Deborah Joy Wilson, nutrition specialist, individual consultant. Also have Jeanette McCulloch, is communications and advocacy specialist at UNICEF. And Ms. Brigitte Tonon, is health advisor, operational health and nutrition technical advisor at Action Against Hunger. Action contre la faim. So without further ado, I'd like to pass on to Jeanette McCulloch.
Thank you, Dima. I really appreciate the warm welcome today. So we wanted to start out today with a quick check-in to level set us all and to get a feel for what your familiarity is with the existing guidance. So we wanted to start out with a quiz. So if you could use your phone or you can use a browser on your screen, go to menti.com and use the code, or you can scan the QR code. I'm going to flip to the next slide, but all of that information will still be available there. And oh, look, this is wonderful. You all have already found your way there. So our first question is about the IFE core group guidance. Are you aware that the IFE core group has IYCFE media guidance? And we can see that we've got a good percentage of our folks that are aware of it, folks that are not aware of it, which is a big part of the reason why we are here today. And I'm going to let you all take just another moment to answer here, but it looks like we're getting a nice stable response of how many folks are aware of the guidance versus how many are not. And I'm now going to switch to our next question. Our next question is about your use of that guidance. So have you used the IYCFE media guidance that is published by the IFE core group? And if you are following along with the interpreter, the first response is yes, the second response is no. And if you have not joined us yet, we are at menti.com and the code is 8338. 1686. And it looks like the link is also in the chat if you'd like to participate there. And again, a big part of why we're here today, even though many of you are aware of the guidance, you have not yet had the opportunity to use the guidance. And you can see how many folks so far have used it and how many have not. Okay, and I'm going to pass this over to our next presenter. Carlene, I'm going to pass it along to you.
Thank you very much, Jeanette. It was very interesting to see that people were aware that there was guidance, but perhaps hadn't used it very much. So hopefully this afternoon's webinar will actually help people to become more familiar with the guidance and perhaps use it. So I'm going to just talk a little bit about what we have in terms of guidance from the IFE core group. Next slide, please. Before I talk about the media guidance that the IFE core group has, I just thought that I would let you know about our main guidance document, which I'm sure that many of you are aware of, the operational guidance for infant and young child feeding in emergencies. So this was the first bit of guidance that the IFE core group ever produced, and it's our most important guidance. The goal of this document is to maximise child health and survival through enabling appropriate infant and young child feeding in emergencies. It provides concise, practical guidance on how to ensure appropriate infant and young child feeding in any sort of emergency. Now, this document has been endorsed by the World Health Assembly and Resolution 63.23 says that all member countries of the World Health Assembly should ensure that their emergency planning is in line with this document. Next slide, please. So just to summarise the different sections of the operational guidance, because it breaks it down into what you should do in different areas. First of all, endorsing and developing policies, then training staff, coordinating operations, assessing and monitoring, and then protecting and promoting and supporting optimal infant and young child feeding with integrated multi-sector interventions and minimise the risks of artificial feeding. If you haven't had a look at the operational guidance before, I would suggest that you have a look. It's been translated into many languages, and you can find it in links that you'll find later in the presentation. But if you just Google search for it, you'll find it as well. Next slide, please. So why did the IFE core group develop resources on infant and young child feeding in emergencies and media and communications? Well, the media is extremely important in emergencies. It alerts public to the fact that there is an emergency and can also mobilise funds and assistance. But the media, when it's not, I guess, informed about what will help to support infants and young children in emergencies, it can also start and perpetuate myths and cause problems. I've lost the slide. Can we go back a slide, please? It can also, we have disaster myths around infant and young child feeding in emergencies. And I'll point out a few of what those are a little bit later. So poor media and communications in relation to infant and young child feeding in emergencies are very common. And one of the biggest problems that we have with poor communications is that they drive and support inappropriate donations and distributions of breast milk substitutes, including infant formula and other milk products. And I'm sure that any of you who are involved in infant and young child feeding in emergencies know how difficult it can be to try and prevent donations and to stop their harmful distribution. But if we have good media and communications, that can actually help to prevent harmful aid and encourage support that protects infants and young children. And so, we want to encourage good media and communications because that will make everybody's job easier and also support the health and well-being of infants and young children and their mothers. Next slide, please. So I'm just going to give you an example here. It's from nearly 20 years ago now, from the Indian Ocean tsunami. But somebody there from the Ministry of Health in Sri Lanka, I think, provided a really succinct example of why we need to have good media and communications in emergencies. So I'm just going to read out this quote. So this was after the Indian Ocean tsunami, and this Ministry of Health official said, although Sri Lanka is a country with a high exclusive breastfeeding rate, there was a myth among mothers about the inability to produce enough breast milk when under stress. A major problem was the distribution of infant formula and feeding bottles by donors and NGOs without appropriate controls to breastfeeding mothers. Donors acted emotionally without any scientific basis, disregarding the dangers of artificial feeding in disasters. Additionally, the mass media was very keen on feeding babies, so made a public appeal to supply artificial milk and feeding bottles. The Ministry of Health faced many challenges to ensure that breastfeeding mothers continued to do so and did not swap to unsustainable and potentially dangerous infant formula. So, yes, describing what happened there in Sri Lanka and many other countries after the Indian Ocean tsunami and in many other emergencies since. And you can in fact see in the photographs there on the slide, both of these photographs are from Sri Lanka, and you can see in both of those photos, infant formula is being distributed. And there are women who are breastfeeding. They're being given infant formula. They don't need it. It's not being supported properly, and it's going to cause harm. And that is why we must do better with our media and communications in order to ensure that infants are protected and there are fewer donations. Next slide, please. To give you an example here from what can happen in terms of what is reported in the media, this is from the Wenchuan earthquake in China, which occurred in 2011. And I undertook an analysis of what was actually being reported in the media at that time. And you can see here that the most common thing that was reported was about donations of infant formula, baby food, or milk being made. The second most common thing that was reported was that babies were in need of milk or were lacking food. And the third most common thing that was reported were that women were too traumatized or malnourished to breastfeed. The things that were not reported very frequently were that actually that mothers needed breastfeeding counselling after the disaster to help them to continue breastfeeding, that donations of infant formula were a problem, and that artificial feeding is risky in emergencies, whereas breastfeeding is vital for child survival during emergencies. So you can see this is an example of an emergency where the media messages were encouraging donations and not reporting on the things that would actually help infants and young children and their mothers and other caregivers. Next slide, please. So the IFE Core Group has produced a number of resources to assist people to work with the media and improve the reporting that is done during disasters. So I have, there are 4 different documents, and I'm just going to give a brief summary of each and what is contained within. So next slide, please. So the first document is the Infant and Young Child Feeding in Emergencies Information for the Media. So this is a basic guidance document for journalists who might not know anything at all really about infant and young child feeding in emergencies. And it describes why infants and young children are vulnerable in emergencies, talks about what the challenges are in feeding infants and young children in emergencies, talks about how the survival of infants and young children can be protected during emergencies, and how journalists can help to protect infants and young children in emergencies. And the key message that is in that box there at the bottom from the document is saying, you know, the media is really important. They have a really important job in protecting and supporting the health and well-being of infants and young children in emergencies through supporting appropriate infant and young child feeding. So, so it's just really emphasising how important they are and trying to get them to do things that are going to be helpful and not harmful. Next slide, please. So the next document is how to write and talk about infant and young child feeding in emergencies. Now, this guidance document is more for people who are within agencies, communication specialists, and any individual who might speak to journalists. So communication specialists or somebody who might be interviewed by journalists about an emergency response. And the purpose of this document is to support communication experts to provide accurate information that protects and supports infant and young children and their caregivers and reduces harmful interventions in emergencies. It describes what messages support and what messages undermine helpful aid to infants and young children. It also provides some information on what sort of photographs are helpful and what sort of photographs should be avoided in media and communications, and describes how to get journalists interested in telling stories and providing information in their stories that supports helpful aid to infants and young children. Next slide, please. Now, this is the sort of the final text-heavy information document. So this is background information to support communications experts. So this document provides more in-depth information for communications experts within organisations and agencies to help them to be effective in their role around infant and young child feeding in emergencies. So it outlines why infants are vulnerable in emergencies, how media communications impact infant and young child feeding in emergencies, what communications experts need to know to help infants and young children in emergencies, how emergencies affect feeding practices. It talks about disaster myths in emergencies, and I mentioned that at the beginning. One of the disaster myths that we have is that stress can reduce women's milk production in disasters. It's not true. It doesn't happen. But it is something that very many women believe, that very many nutrition workers and health professionals believe. And it's something that there needs to be good information in media communications about, so that that can actually support women to keep breastfeeding through emergencies. This document also describes what content should be in media reporting, ideally, in order to support the well-being of infants and young children in emergencies. Next slide, please. The final document that I'm just going to tell you about is the Model Joint Statement on Infant and Young Child Feeding in Emergencies. This isn't a guidance document. This is actually a template document to actually provide, almost as a press release, it can go out to journalists to explain to them how to, what needs to be done following an emergency, how to, it also talks about how joint statements, so a statement that is supported by a number of organisations around infant and young child feeding in emergencies, that will contain information that explains, why breastfeeding is important in emergencies, how to support women to continue breastfeeding, why donations are a bad idea and how they can be harmful. The idea with this is actually for it to be given to journalists very soon after an emergency, to try and stop donations from coming, because they often come very quickly. So our Model Joint Statement document actually has a joint statement in it that can be adapted very easily for any emergency, but it also explains how to use it as well. So it's a very, very useful tool for those who are, on the ground when an emergency occurs and need to do something quickly. This tool is there to help you to get a joint statement out very quickly. Next slide, please. So turning all of this guidance into action, well, some of the things that you can do to make that happen is, firstly, include the guidance in orientations for new communications and fundraising staff, and ensure that existing staff are familiar with the guidance. Deliver training on the operational guidance on infant and young child feeding in emergencies in the media and communications guidance to staff. Integrate relevant content into existing organisational policies. And as an emergency preparedness action, plan for early release of a joint statement in the event of an emergency by coordinating with potential signees to a joint statement before an emergency occurs. Next slide, please. So I've just got a question here just for you to think about. How do you think you could use the IFE core group media and communications guidance in your work? Who might you tell about it? What might you do? So this is just something to think about as we continue through the rest of the webinar. So I'm just going to hand over to the next presentation now. I hope that some of the information that I've provided has been useful to you.
I'm going to share my experience in Nigeria with respect to communication in emergency situations. In particular, this is a COVID situation that I'm going to talk about in this Niger case study. Next slide, please. And so it's about the COVID-19 pandemic. We adapted Now, here is the context. We adapted uh, our practices for the COVID-19 situation. We wanted to continue feeding children during this pandemic. We adapted the messages uh, for COVID-19 to make sure that the right messages and recommendations were clear. We wanted to promote breastfeeding among health personnel and community personnel. And we also wanted to pass on this information to families, and we wanted to warn people of risks. We want to prevent risks of industrial gifts, which is something which happened in the past. So we adapted, as I said. We decided on two approaches for the country. We made a joint statement with the nutrition cluster, and also we adapted messages about breastfeeding. We had adapted them to the COVID context. For this joint statement, it was a global statement. It was aimed at all of the persons involved, all of the actors. Well, as for the channel of communication, well, it was disseminated throughout different types of media, television, the digital press, and also through radio, the community radios, and the written press. The promotional message for COVID, this message reached practically all the community, practically all persons involved were reached. So we used the radio, the community radio for that. We used the social media too. And the so also we use Twitter, Facebook, Instagram, and also SMS messages, text messages that were disseminated throughout the country. The objectives of the joint statement, it was to coordinate the response during the COVID pandemic, we wanted to fulfill another objective. We wanted the international code for milk substitutes to be abided by throughout the country. We wanted to abide by these rules on the rules concerning the sale of artificial milk. Here is an example of some messages that were developed in our joint statement. This was in a technical note. We included key messages with recommendations, but also suggested actions to be carried out when messages are disseminated. Next slide. Here, too, is an example of messages. We wanted to develop a framework for our messages. For every message, we wanted to include primary and secondary messages. We developed different targets and different channels for disseminating these messages. We so when we made the messages, we adapted them to each region and to each type of use, depending on the target group. So in each region, health personnel and nutrition personnel were targeted, the media too, and we wanted to send these messages also nationally in the different regional languages. So afterwards, the media was given these messages so the media could disseminate the messages in through community radios. These messages were adapted so they could be used in UNICEF social networks, Twitter, Facebook, and Instagram. We adapted these messages to be uh, transmitted by text messages and WhatsApp for cell phones. We also adapted the messages for a platform for young people, Muya Matafa. So these messages were adapted for this platform for young people. For the After adapting the messages, we worked for 3 months with community radios. That was from September to November 2020. These messages were disseminated on community uh, radios throughout the country. And I mentioned these messages earlier, but for each health district, an interactive system was set up uh, on a weekly basis. The idea was to discuss the messages and to see how uh, to explain how breastfeeding had to be done during the pandemic. We have support groups in different zones. We call these zones emergency zones. Radios were purchased and made available to support groups to pass on messages, and this allowed mothers to listen to messages that were transmitted throughout the network. As for the Kalango Studio, it's a studio which has a partnership with 45 partner radio stations. We organized a discussion on television, which was transmitted through community radios. We organized these discussions. on the media with participants from the health ministry. And also, we had a UNICEF representative, a pediatrician, who provided information about COVID-19 and how to continue to feed children during this COVID-19 pandemic. What worked well and what didn't work? The most important thing was that we had the signing by the Minister of Public Health. This made it possible to do uh, to publicize this and to promote this and promote the messages and to uh, draw this issue to the attention of many people. And what didn't work? What didn't work? It took a lot of time for the signing of the declaration. There's a lot of coming and going, and there's already a gift of in a donation of in formula milk, industrial milk. This was from certain companies that sold artificial milk. As for community radios, what worked and what didn't work, these radios enabled us to work on a contractual basis with community radios throughout the country. 99 spots were produced, and there are 3,790 broadcasts per day. We potentially reach 6 million people out of the 25 million in the country. And there's a participation of many medias on the national level and also in the field. And also, despite the challenge we had to face, we used various means to transmit the messages. The government, through the health ministry, uh, took the lead in this program to organize various events in cooperation with community radios, and this also organized collection of donations. What did not work? How do we know how many people were reached? It was difficult to know. We had contracts with community radios, but we don't know how many people were reached, how many people listened to these messages. The figures that we have are just a projection on the basis of these community radios that can be more or less accurate. So we did not have accurate figures. As for the social media, we can't know exactly how many people looked at the messages on Facebook, YouTube, or Instagram. Maybe the person didn't click. And so it's hard to know how many people use these social media. And we don't know what the impact of these messages was on the population. And we don't know who listened. So this is really something that didn't work. What are the challenges? What are the lessons learned? As for challenges, translation of messages and production of spots into local language. That was very time consuming. Our country is vast. We have 8 local languages. When I take the example, for example, of a language which is called Hausa, spoken in many regions, but some words and some expressions differ from one region to another in Hausa language. So we tried to translate messages for each region. And as I said, we couldn't measure the impact of our messages on the population. We didn't know what the impact was. And as for the platform, we had the young person's platform. We relied on it. It took us a lot of time to adapt our action to this platform, and it wasn't functional. We were not able to use the platform optimally to transmit messages. We would have liked to have more platforms, more diversified platforms. So what worked also? The leadership of the government and also the coordination. The coordination was good with different players because everybody started actions, set out messages, and all this was coordinated. So we were able to continue our activities with respect to feeding infants and young children. We chose the right messages and the right media, and we chose the right channels. So this worked with all the actors throughout the country. As for the lessons learned, the social media are powerful. They're an important, powerful channel of communication, and they make it possible to complete the other channels of emission. I mentioned the community radios, and but we used visits to Pearson's homes. That way we could provide specific counseling, but the social media and allowed us to understand how important the community radio was. And in some areas, it's hard to reach the population. So the community radios and also this SMSs, the text messages, enabled us to continue our action and to reach the population, even during this crisis period. The fact that we had partnerships with community radios enabled us to act fast and to set up uh, our actions, provide information, and to continue disseminating information. Thank you very much. I will pass the floor to Deborah for the next presentation. Thank you.
Yeah, greetings everyone. I'm now going to talk about media and communication materials that we really need to avoid. Next slide, please. Next slide, please. So during this presentation, I'd like you to consider the context in which you work or you have worked, and how you can apply the learning from today to avoid harmful communication and to promote recommended practices for the health and well-being of infants and young children and their mother or primary caregivers. So coordinated, timely and accurate and harmonized communication to the affected population, emergency responders and the media is essential to the well-being of the population, and this is highlighted in the operational guidance. So communication and the media play a critical part in emergency response by informing the public of the emergency context and also mobilizing funds and assistance. However, inaccurate, erroneous or incomplete information this may be written or images, they can be misleading and harmful and thereby undermining good infant young child feeding practices and services. So some of the reasons for potentially harmful information include a lack of awareness of infant young child feeding and emergencies and humanitarian aid more broadly, many myths about infant and young child feeding. It's hard to publicize aid that's not in the form of giving physical goods, and the perception that donations and distributions of commercial milk formula, which is infant formula, and other breast milk substitutes, bottles, teats, and other inappropriate supplies are helpful. So the increase in the availability of and access to platforms through which to communicate and internet technology, social media, etc., has increased the risk of harmful information being conveyed. And in this presentation, I will give examples of communication in the form of script and images which can cause harm. Next slide, please. So the types of communication that can cause harm, I've categorized into misinformation, which is incorrect or erroneous information, or images which are spread regardless of that intent to mislead. So they may be, inadvertently misleading. And disinformation, and that's misinformation which is knowingly or intentionally spread, which is deliberately misleading or biased information and could be manipulated narrative or facts. So these can be again broken down into further categories: misconceptions and myths, mischaracterization, which is describing a situation, event, or person wrongly. That is misrepresentative, and this may be because the information is incomplete or it's not put into the context, or it may be inappropriate, which, in other words, not suitable or proper to these circumstances. And these can cause harm by reducing caregivers' confidence, or caregivers demanding aid, which can be harmful, or preventing them from actually getting the help they need, or result in provision of harmful aid. Next slide. So following, I'm going to present some examples of mischaracterization, misconception, or myths, and some clarification. So I've given some examples of misclarification there. And for example, this is a common presentation that infants are crying because they're not getting enough food or breast milk. And we've just got to understand there are many reasons babies cry, especially during an emergency when the family's in turmoil. And infants and young children also feel stress, and breastfeeding can actually help calm mother and child. We also still have that, some remnants of that philanthropic mindset of giving aid in the form of product. Instead, there's a need for articles informing on breastfeeding and complementary feeding as actually being protective, life-saving practices. When we look at misconceptions or myths, not having enough or good quality food is commonly conveyed, but putting the child to the breast frequently with correct positioning, attachment, and other support, it supports breastfeeding. Being severely nourished or stressed can very temporarily affect mother's breastfeed. Again, put frequently for successful breastfeeding. Caregivers can demand commercial infant formula, milk formula, as they're influenced by the media and seeing donations. So they think that's what they need, even if they have been breastfeeding up to that point. Next slide, please. So I've given lots of examples of inappropriate communication, and a lot of these are highlighted but by the recommendations in the International Code of the Marketing of Breast Milk Substitutes and the subsequent addendums. And these relate to milk products that are specifically marketed for feeding of infants and young children up to the age of 3 years. And it relates to other foods and beverages promoted to be suitable for feeding a baby during the first 6 months when exclusive breastfeeding is recommended. Information on artificial feeding, including that on labels, should actually explain the benefits of breastfeeding, the costs and dangers associated with unnecessary or improper use of commercial milk formula and other breast milk substitutes. And the code explicitly states that there should be no advertising or other form of promotion to the general public. And this would include any advertising through mass media outlets such as television, magazine, billboards, websites, or other social media. So considering complementary feeding, foods to not call for or donate, that's also important. You know, foods and drinks of low nutrient value or high in salt and sugar, foods and feeding bottles, foods that may cause choking, such as whole nuts, foods labelled for children less than 6 months of age. When we're considering images, there should not be pictures of infants or other pictures idealizing the use of breast milk substitutes. Babies with the mother edited or cropped out of the picture as the mother, you know, we need them together as the mother and baby are a biological caregiving dyad. Images where informed consent has not been obtained, you know, we really need to ensure that all images have got informed consent. You know, getting away from perhaps a patriarchal view that consent is implied through the assumption that the subject won't mind. So in emergencies, an influx of commercial formula donations has often been observed after the emergency onset, followed by untargeted distribution of commercial milk formula and eventually a decline in exclusive breastfeeding prevalence in the affected area. This was an example was in the Ukraine 2015 emergency and the Yogyakarta Indonesian earthquake in 2006. So in emergency situations, the code is particularly important for controlling donations and distributions of these products. So these children, there are also infants who cannot breastfeed, such as infants separated from their mothers, infants or whose mothers are ill or have died, or those not being breastfed prior to the emergency where relactation is determined not feasible. And these children do need targeted support with controlled use of commercial milk formula provided by health workers, community workers, and only to mothers who need it, and mothers clearly informed of the hazards associated with improper use. Next slide, please. Now we're going to look at media articles that can cause harm, and we're going to whiz through these. But as we look at the following slides, consider what is the issue of concern? Is it mass characterization or misconception or a myth, or is it inappropriate? How may it do harm? What could you do to respond to the issue if you became aware of it, if you saw an article or you saw an image that was potentially harmful or inappropriate? And how could it have been prevented from happening in the first place? In other words, being presented. So next slide, please. This is an article that implies the mother cannot provide enough breast milk for her baby because she doesn't have enough or good food. But in fact, there are many reasons why a woman may report that she does not have enough breast milk. Next slide, please. Here, article from East Kenya on the crisis that again implies that mothers who are malnourished cannot breastfeed. Next slide, please. This was an article here from Ukraine and one from Libya, and they call for donations of commercial milk formula. Inappropriate. Next slide, please. Here, the Australian Defence Force providing baby formula. So, you know, it implies that baby formula or commercial milk formula is needed to save lives, and the heroism of providing it. Though it may be slowly changing, again, you know, I reiterate the vestige remain in the reporting of saviorism and that privileges the neo-colonialist views, and the attitudes of aid workers and experts are superior to the perspectives of locals who are actually experiencing the crisis. Next slide, please. This from the Turkish Canadian Society of Edmonton, collecting commercial milk formula donations. It reflects again a violation of the code, and also the commercial milk formula procurement standard operating practices, which were actually issued by UNICEF, and also infant young child feeding statements released by the national government. And this exacerbated the spread of misinformation on commercial milk formula feeding and well-meaning individuals' lack of awareness and appropriate infant feeding practices and emergencies. Next slide, please. Again, sharing information on their donation efforts is that they're going to help through this bulk provision of commercial milk formula. Next slide, please. This actually relates to and states and displays loyal health workers supporting collecting commercial infant formula. Next slide, please. Here we have an example of, how much gratitude is given for a Malaysian businessman giving out infant formula, which, is well intended. People really think they're helping. But it's implying his, his act as one of caring by stating childhood experience with hunger motivate him to provide infant formula to less fortunate children, earning him the affectionate name of Abang Susu, in other words, brother milk. So although he's meaning, he has some good intentions, really the message needs to get across. Next slide, please. Again, another example. This is in northern Lombok, Indonesia, and breastfeeding mother implies that she needs infant formula, states that she's worried her baby is going to get sick because of the way things are, and that some commercial milk formula is therefore needed. This, although she's a breastfeeding mother. Next slide, please. This article about the Maui fires implies that commercial milk formula is an essential baby supply. Next slide, please. This Japan earthquake photo gives inappropriate emphasis to the feeding of commercial milk formula and bottle feeding, implying that it's a good support role of aid workers to be giving it. So the preferred image would be of a woman holding and breastfeeding, providing breast milk for her child, supported by the aid worker. So we have a few more slides, but we go down to a bit further because we're running out of time here, and you'll be able to get these within the slides when you receive them. So if we can move forward down to the slide on the common and rare media analysis, that's correct, great. Where, some of the messages, and again, this was done by Carleen Gribble, who presented earlier, an infant feeding and emergencies core group steering committee member. So, highlight the babies were vulnerable, and that, and no link was made to the role that breastfeeding plays in preventing diarrhea, and that formula feeding can, cause for diarrhea. They found that, babies need to be fed. Mention women breastfeeding, but it's used to show weakness, with no mention that breastfeeding actually protects babies, and providing infant formula will save babies, but no mention again of the risk of formula feeding. So can you go to the final slide, please? So, I reiterate, agencies need to, and every representative of agencies need to support the media with appropriate information, so that the media can convey and portray information that supports life-saving infant feeding and emergency practices. They need to ensure that communication encourages helpful aid. And previously, Carleen gave some examples of what you can do. So again, every time you look at your communication, consider do no harm. Thank you. And I apologize, we've had to scroll through some of those slides. You'll see when you receive them. Next presenter, please.
Well, Deborah, thank you so much. That was an incredible presentation. We are going to be moving to our next Mentimeter slide. So for those of you who are just joining, if you can visit at menti.com, you can also use your device, your phone or a tablet to scan the QR code. Or additionally, there is a link that you can follow in the chat. So if you click on the link in the chat, that will take you to our polling question. And again, it's menti, MENTI.com, and the code is 833-81686. And that code will still be available as we bring up the next question. So we really want to take this opportunity to learn from all of you. So we've got a question up here on the screen. It is, what would you need to improve IYCFE, infant and young child feeding in emergencies, messages and communication during the emergency response? And again, if you go to menti.com and use code 833-81686 to share your messages, I think this is a great opportunity to really integrate everything that we have heard so far today. We heard really about what the harms of media messages are that undermine the best practices of infant feeding in emergencies. We heard an incredibly inspiring example in Nigeria of best practices in action, and learned a little bit about what works, what doesn't, what the challenges are. And we've gotten some great strategies for ensuring that the information that's out there during emergencies encourages helpful aid and helpful information for families as well. And we've already got a number of responses here, including what would you need to improve? It would include coordinating with our communications colleagues. We heard a lot about that during the preparation of this webinar, and I think this is an incredibly important piece of next steps. Acceptance of my own organization. Some staff know what's appropriate and what's not. I think that very much coordinates with this earlier point, right? That this is something that we're all going to want to go and take back to the organizations where we work and make sure that this kind of information is disseminated to the folks who really need to operationalize it during times when one of the things we heard about, of course, in preparation for this webinar was this is one of many, many competing interests during that time. So making sure in advance that folks have that information. Key do's and don'ts for media communication in IYCFE. And one of the things that you'll receive as a follow-up are the recording for this presentation with many of the materials that were shared here. Toolkit with easily adaptable key messages, educate journalists, easy to use examples for our communications department. Again, this idea of what does it take to help share this information with all the people who need it in a timely way. Supervising information on social. There's so much here that there's no way I'm going to be able to recap it all at this point. But what I do want to do is move on to our next question briefly, just so we have enough time for Q&A. So our next question here, and thank you all for sharing these points. All of these points are going to go back to all of us at the IFE core group, and all of your thoughts, feedback, information, incredibly helpful. Our next question is this. Please suggest one message that we could use to promote infant and young child feeding during emergencies. And again, we're in the same place. It's menti.com and use code A3381686. I love the first message that came up on the screen. Women need lactation support, right? Support mothers to breastfeed. Breastfeeding save lives in emergency. First, do no harm. First, do no harm. Mother and baby are one unit. Breastfeeding protects infants. I'm going to let this continue to run because I think there's some really amazing messages that are coming in here. I think this is all important information for all of us to take in and for all of you to have available as you're thinking about communicating as well. And I'm going to leave this up for just a moment as I hand this off to Brigitte for Q&A. You can continue to pop messages in here. And again, we will get all of those. Great. And Brigitte, I'm going to hand over to you.
Yeah. Thank you. And thank you everyone for participating to this webinar. And so we have been reading all of your questions. So I've got a first question for you, Caroline. So one of the best practices for media relation in emergency start before the crisis emergency. So like, for example, forming or maintaining a good relationship with the media or providing the media continued facts and information and good breastfeeding practices so that we could control the narrative by the media in emergency situation. So one participant is curious to know if this was a case for the case study given in Sri Lanka. So, for example, to have continued and strong relationship with the media. So, Caroline, the floor is yours. Thank you.
Thank you, Brigitte. I don't know what the situation was in Sri Lanka, but I do agree. It is the best situation is to develop relationships with journalists before the emergency happens, and for them to have increased knowledge, and so that they can actually be champions when an emergency occurs. And so getting journalists interested in emergency preparedness, I think is something that is quite a valuable thing to do. And in countries where there are seasonal emergencies, so we know in some parts of the world we have typhoons every year, there are cyclones every year, there are bushfires every year. Getting journalists to actually provide messages before the emergency occurs that breastfeeding is a part of emergency preparedness, that it protects babies if an emergency happens. That's just one thing that can be done to actually build relationships with journalists so that when an emergency occurs, they already have quite a lot of knowledge and they're going to do good work. So I think that development of relationships is, I agree, 100% very, very important.
Thank you very much for your answer. I hope this was clear for everyone. Now we've got some questions for Aisha. So Aisha, one of the questions was related to the media. So media conveying information and communication in different languages that was understood. So you have mentioned some translation, but can you detail a little bit more? And there was a question specifically dedicated for individuals with disabilities. Did you consider specific communication for this group? Thank you.
Speaking of messages, they were translated into the 8 main languages of the country. The translation was adapted to each region, so the message were transmitted into the local languages in each region. And also in the main language of the region at the national level, the messages were translated to the 8 languages of the country. Because the radio at the national level, it emits all over the country. The community radios were translated into 4 languages, some ranges in 5 languages: Jam, Pol, Gumantier, Peul, Hausa, Kamuri, Tubu, El Arabic. These are the main languages in the country. So we made these translations, as I explained in my presentation. Translations were done. Even if it was in Hausa, we had to adapt Hausa to different regions because some words can vary within Hausa, vary according to region. So this was done. So every community radio gave us a plan for broadcasts. Some broadcasted twice a day, some broadcasted 3 times a day, with a calendar for each language and each day. So this is what was done. As for children with disabilities, we didn't focus on them specifically. The messages were more general for children, but we mentioned possible support for women who were affected, already had COVID, and no, we didn't create any special messages for disabled children. So in Niger, we started to work on early child development, children with disabilities. So we were able to move certain children to the right places, to hospitals. And this was possible out in the field, even in the context of COVID. And so we have to find out what happened to these children. And this was done. We found out what happened to these children and informed their families.
Thanks a lot. I will keep you, Aisha, with the second question. So it was great again to see all your lessons learned. We wanted to know if you have experienced any social media crisis in your communication, like, for example, the spread of misinformation on IOSF, or was the process really smooth?
No, we didn't have any problems with misunderstandings or inappropriate messages in the country. In Niger, we always have worked with the media. When I talked about community radios, well, I could say they were used quite a lot with COVID. So there's a committee, a committee of journalists, which deals with nutrition issues and with breastfeeding and complementary food. And this takes place every year. And we always have a one-day briefing about breastfeeding. This is for journalists. Maybe there were some misunderstandings, but when we carry out for training programs, a lot of questions are asked. So I don't think we had any problems in terms of inaccurate messages or inappropriate messages in the media. Because we have a long-standing collaboration with media and to promote breastfeeding. Thank you.
Thank you, Aisha. There was another question related to the implication of influential actors, like, for example, men and grandmother, but I think you have responded by your first answer related to the translation and how you have managed to reach different type or different group of population. So thanks again, Aisha. We've got as well a few questions for Deborah. So Deborah, someone wanted to know if you have any documented example of spillover when free commercial formula is distributed.
No, I currently don't. I'll just refer that I was very focused on the avoidance. So no, if we have something, we will send that out again when we send the slides and with the answers to the questions that haven't been answered today. My apologies.
It's okay. Thank you for your answer. But there was as well a request for another example where untargeted breastfeeding donation has been timely reported and addressed.
Is this for me, Brigitte? Yeah, again, I was focused on the poor examples. I will share this to Carleen. Are you able to, off your head, be able to give an example there?
Yes, I can. So there have been quite a few situations over the years where large donations have been reported in the media that they're coming, and where that reporting then has enabled intervention to actually prevent the donations being sent. So this has happened particularly when there are donations that are coming from one government to another government. And you know, if you hear about those donations, sometimes the IFE core group can actually help in preventing those large donations from going ahead. But it's one reason why it's a good idea to keep an eye on what is happening in the media, because sometimes it gives you warning about donations that you're then able to prevent from being delivered.
Thank you all for your question. There is this recurrent question on what to do else in case if breastfeeding is not available or not feasible. So here, during this webinar, we were really trying to see about communication to avoid harmful distribution or harmful intervention toward breastfeeding and infant feeding. We will share with you some link to have more explanation on how and when breast milk donation can happen, and when it can, when breast milk substitute can be used. For instance, there was question related to contexts that are really difficult, like for example, right now with the gas war in Gaza. So you have, and again, all this technical documentation will be shared with all of you. Let me check a little bit more in the Q&A if there was any more. And waiting that, there was an additional question for Aisha. So Aisha, we clearly understood that there was a lot of work to engage with the media and that this has required extensive work. Someone wonder if you feel that it was worth the effort.
Thank you very much, Brigitte. As I said, we don't always know the impact of messages. We don't know the impact of the efforts we make, but in this context, it's important to continue our action. We can't always got into the field. The community actors, well, the Reed Lakes group, we had a lot of them, but they can't all carry out all these activities. It was important to continue to pass on messages. There are a lot of activities going on, many actions going on. This required a lot of time from us and effort, and we're able to develop messages. But we had to continue. For me, it was important to do all this. We have to continue, especially in this context, we have to continue passing on messages with all the relevant messages about COVID. And we have to address questions for mothers, for families. What can they do? So, thank you.
Thank you so much, Aisha, for your answer. Deborah, there was one of the last questions we received that is really interesting. It's a nutritionist, and he or she is asking how it can be a fact checker of media information. So meaning what can be the role of field practitioner like nutritionist to check and verify media information?
Yeah, again, this is also where there's strong collaboration with your communications colleagues in your agencies, where they are informed on correct communications for infant and young child feeding in emergency contexts. And some of the examples of what can be done to reach out to colleagues was presented in Carlene's presentation. So, and many organizations, they also have media people who actually do scan the media. For me, when I've worked as a nutritionist in a big organization, I've also gone through some of the pictures and pictures that are presented within the media platform and check that they're conveying the correct case study information, etc. So yes, social media is a challenge because so often it's not moderated, and so we really need, if we're setting up social media, need to ensure that there are moderators available. I hope that answers some of your questions, but yes, it is challenging and it does require time. And also for us as, you know, individuals to all look and when we notice something, to notify the appropriate people. So we need to be proactive and take action to respond. And some of these in emergency can reporting through to the cluster for them to manage some of the communications. Thank you.
Thank you. Thank you for your answer. And related as well to the relation with the media, Carlene, there was this question for you as well on how can we build good relation with media and to ensure, so especially with a journalist.
Yes, there will be something that I have found in my work with journalists. Is there are some journalists who are very interested in this area, and they're very happy to write articles and to listen to what you have to say. And you know, cultivating those journalists and relationships with those journalists is very important. There are other journalists who will never be interested in this. There will be some journalists who have had their own personal experiences around breastfeeding or not breastfeeding their own baby, which means that they cannot set aside. And so those journalists will sometimes not be helpful at all because they don't want to think about what you're saying to them. So I think it's a case of finding the people who are champions, who will be champions for you. That won't be every journalist, but there will be journalists out there. It's very often journalists who are interested in women's health, and so you can look in your own country, who are the journalists who are writing about women's health, who are the journalists who are interested in women's health issues, who are the journalists who are interested in children, and actually just contacting them and saying, I work in this area, would you like some more information about this particular subject, because we have this problem and we would really like for you to be able to help us when an emergency comes, and you can help us save the lives of children. That work is so important, the work that journalists can do and that media can do. But I would really also urge people to do work with the media and communications people within your own organisation, because very often communications experts move around. They can't know about everything, but this is something that they do need to know about. And so if you can work with them and help them to be confident about this, and fundraising people as well, because sometimes the messages that fundraising people put out aren't very good. If you can bring them on board, then that will also make your job easier.
Thank you very much, Caroline, and all our panelists. I will give the floor to Alex for wrap up and conclusion.
Yeah, thanks, Brigitte, and thanks everyone. I just wanted to, maybe there are a few slides I wanted to share with all the participants before the departing words. Next. Yes, next. Yeah, so one thing that I really wanted to emphasize to all the participants, and again, thanks to the Global Nutrition Cluster Technical Alliance for all the support provided, is in case any of your countries, any of the organizations that are connected to this call or other partners that you may have needs any form of nutrition in emergency support, and these are the type of support that you can access, please contact the GNC Nutrition Cluster TA, and you have a link to the website where you can request support. And again, there is several types of support that you can request, and then you can discuss directly with the GNCTA focal persons and and understand if and how you can access that technical assistance. Next. So this is the website, just to give you an idea where you can find request support, and click on that upper button on the right. Next, you have a link in the chat just in case you want to navigate it. And this is the form, a very simple, straightforward form, I hope, that you can just fill, and you will be contacted, as I said, by the focal persons, and they will engage you and understand better on the request you are making and the type of support and the way this can happen. Next. So before I would like to encourage all of you, those that are left, to please do fill out the webinar evaluation. And there is the question that Carlene asked you all, asked us all actually, all of us, to answer. So please take your time in answering the webinar evaluation. And while I encourage you to do so, and this will be popping up right after you close the webinar, we close the webinar, I wanted to again thank everyone around that supported the design, the actual implementation, the technical assistance that we received from the interpreters, the GNCTA, on behalf of the IFE core group. But in particular, I really want to thank and praise the work of the IFE webinar working group that have done a fantastic job in the past year, if not more, in conceptualizing this activity. Yes, it took almost a year or even more. So many other colleagues have provided support. They may not have been presenting today, but I want you to know that there are so many people that helped put together these activities. So thanks everyone. We are going to launch other webinars, so stay tuned. And these are hopefully webinars that will, again, tackle issues and concerns that you all have. And so we request you to join again and in the conversation. So thanks again, and please do respond to the webinar evaluation. Thank you. Over to you, Sania.
Thank you, everyone. We have come to the end of the webinar. So thank you, everyone, for joining, and have a nice day. Goodbye, everyone.